The overall goal of this initial transcranial magnetic stimulation, or TMS, treatment visit is to determine the patient's motor cortex location and stimulation intensity necessary for the patient's TMS treatment, which targets their treatment-resistant depression.
So the main advantage of this device over other current FDA-approved devices is that the unique coil design, it's able to produce a wider and a deeper stimulation over the cortical targeted area in the brain.
In randomized controlled studies, significant improvement has been demonstrated with shorter sessions and fewer pulses than with other FDA-approved devices.
TMS treatment should only be performed by personnel adequately trained and certified by the device manufacturer. Prior to these procedures, have the patient complete a TMS safety questionnaire to ensure that TMS treatment is both safe and appropriate, and have them review and sign an informed consent document detailing the procedure. To begin preparation, have them sit in a chair that is positioned in front of the TMS machine's cart and ensure that they are at an appropriate angle for the coil to be positioned comfortably on the head. At this point, the patient should remove any eyeglasses or other metal on the head. Also provide earplugs and ensure they are properly positioned to protect hearing. To facilitate locating anatomical landmarks on the patient's head, use a stretchable cap with a chin strap and black and red flexible rulers. Slide the cap onto the patient's head with the front over the forehead just above the eyebrows. The cap's red stitch midline should be along the midline.